February is American Heart Month, and ARH is encouraging Kentuckians to schedule annual screenings for overall heart health.
So joining us this morning to tell us ways to prevent coronary disease and recognize early symptoms is interventional cardiologist Dr. Akanksha Thakkar. Thank you so much for being here.
Thank you for having me.
So, Dr. Akanksha, can you tell us a little bit about what all of this is? So what are the symptoms of blockage in the heart?
That's a great question. So some of the symptoms of having blockages in your heart will include having chest pain. Sometimes it's not so much a pain, but it is a discomfort, which can feel like chest pressure. It can also feel like a squeezing or a tight sensation. It can go to your left arm. It can go to your jaw. It usually comes on with activity or even with stress sometimes, and resolves when you rest. It can also be associated with some other symptoms like nausea, sweating, shortness of breath. So if you have any of these symptoms, then it is important to see a cardiologist or your primary care doctor to order some testing to see if you might have blockages.
So you kind of just answered this, but are there any other signs of when we should seek treatment with a cardiologist?
I think if you're having any of these symptoms, or even if you have risk factors for having blockages and you are concerned that you might have blockages, then it is a good idea to see a doctor. So that would include, risk factors like if you have been smoking for a long time, or if you have diabetes, high blood pressure, high cholesterol, or even if you have a family history of having members in your family who've had heart attacks at an early age in their 40s and 50s, then that is a risk factor as well. So if you have any of these risk factors, or if you have any of the symptoms that we talked about, then I think it's a good idea to see a doctor.
So tell us, is there anything that someone can do to prevent having a heart attack?
Yeah, absolutely. So a part of having blockages in your heart, a part of it is controlled by genetics, and that's something you can't control, but you can definitely take control of your risk factors, which would mean regular visits to your doctor to make sure that your blood pressure, your cholesterol, and your blood sugars are all under very good control. And another very, very big thing is if you're smoking, then to quit smoking. And while that is difficult, if you are motivated to quit, then you can absolutely do it. And doctors, your primary care doctor, even your cardiologist can help you with quitting smoking. And then the other thing would be to eat a heart-healthy diet, which would mean more fruits and vegetables, more lean meats like chicken, fish, and staying away from fried food, processed food, sugars, and just staying away from red meat, so eating it in moderation or avoiding it completely. And then finally, also exercise. Getting in about 30 to 40 minutes of moderate intensity exercise on a daily basis, at least 5 times a week, is definitely beneficial to your heart health.
Now, if somebody wants to reach out and talk to you, per se, how do they go about doing that?
They would just give us a call at our clinic number, which is 606-439-6728, and they can schedule an appointment, and we'll be happy to see them.
Dr. Akanksha, thank you so much for being here and allowing us to understand a little bit more about what we need to do to take care of our health.